Well, good evening.
Mask off. Camera on him.
Good evening. My name is Nicholas Weaver, and I work with Anne-Marie Wallace in Baptist Community Relations Department. Anne-Marie, can you please wave your hand? Thank you. I'm super excited that you all are able to join us this evening. Men's health is such an important topic that it can span and affect our community greatly. So we thought it would be a great idea to actually come together and provide additional support and resources in the form of this table talk. So through the youth of Baptist health communities, we're able to partner with churches and additional community resources and organizations. So without further ado, I pass it to Keith Norman.
Thank you very much. And welcome to the Baptist Healthy Communities Men's Health Summit right here at First Baptist Church on Broad Avenue. Let me thank the staff of Baptist for all of the hard work that they've done and the staff of First Baptist Church for the great work that they are doing. Let's pause for a moment. Since this is a house of worship, we begin with prayer. With respect to all faiths, we'd like to say thank you, Lord, for life, health, and strength. Give us insight and wisdom on tonight as we bring forth this idea and all of these thoughts impacting our community so that men and women and all people can live a healthier life. It is your desire that we would all live a better life, a healthier life, and a life that is good and pleasing. With respect to the faith of all, in the name of Christ, I pray, amen. Let me introduce all of our panelists, but let me also remind you that we are recording this for posterity's sake so that you will be able to watch it in future moments and times, share it with your congregations, and also get others well informed about the things that are going on. I'd like to start by introducing this stellar panel that we have with us on tonight. From my far left over to my right, I'll begin with Dr. Steve Gubin, a cardiologist and president of Stern Cardiovascular. Thank you for being here with us on tonight.
Thanks for having me.
To my immediate right, Dr. Santiago Aguilar, the hospitalist and medical director for Baptist Medical Group and Baptist Memorial Hospital, Memphis. Thank you for sharing this evening.
Thanks for having me here.
And also a good friend and a frat brother, Dr. Walter Rayford, urology specialist of the urology group and immediate past president of the Bluff City Medical Society. I want to jump right in. Thank you, Walter, for being here. All right, I want to jump right into these questions. There are some great questions, and then we have some questions coming in from our audience. And I just want you to take, Dr. Gubin, take the first shot at this one. What impact has COVID-19 had on your patients and your practice?
Well, this pandemic has had an effect both physically and mentally on our patients. You know, in the Mid-South, but first of all, heart disease is the #1 cause of death in both men and women. And it's even more prevalent here in the Mid-South. And when we talk about cardiovascular disease, we talk about modifiable risk factors such as hypertension, diabetes, sedentary lifestyle, increased stress, and all of those things have been made worse by this pandemic. And what I've found is that our patients, sometimes, especially men, haven't been that compliant. And as a cardiologist, it's very important that our patients follow up on a regular basis. And during this pandemic, a lot of patients just kind of forgot about their health. They didn't show up to the doctor. And we actually saw during this pandemic that there was less heart attacks that presented to the hospital. We couldn't figure out why. It's because patients were afraid to go to the doctor, and a lot of people were having events at home and maybe have even died before they got to the hospital.
Wow, wow. So I'll go to you, Dr. Rayford, and then we'll come back to you, Dr. Aguilar, because you really have a broad sense of it. But in the practice sense, what has COVID-19 done, or how has the impact been on your patients and your practice?
Well, initially, there was a tremendous impact. Many hospitals and many practices, of course, were only seeing patients on an emergency basis. Within our practice, we only saw patients on an emergency basis, and we developed telehealth. So that allowed us to continue to engage with our patients. But of course, with telehealth, you can't touch the patient.
Right.
But it allowed us to follow up with the patients to make sure that they did not have an acute event. And if they did, to direct them to the care that they needed. Of course, as Dr. Gubin was talking about, many patients did not come in because they feared the pandemic, reasonably so. And because of that, now as the society is opening, we're beginning to see more men who now have not necessarily advanced disease, but progression of disease that we could have caught earlier. And I think that's been the major impact. We still do telehealth, not as much, and now we're beginning to see those patients come back into the office. Many of the patients have not been in the office since 14, 16 months.
Wow.
And are finally coming back in for that follow-up care. And with respect to prostate cancer and with respect to endotype cancer, urologic cancer that is, I think soon we will begin to see increased number of those patients who are having a higher PSA now as opposed to when we would have seen them a year ago.
So before we go to Dr. Aguilar, what you both are really saying is do it now. Get in there and get checked out now. No more delays.
Absolutely.
And no more waiting.
Exactly.
Yeah, that's a good takeaway right
Absolutely.
away.
You know,
I think most offices.
I think patients thought that they were doing the right thing by staying away from the office.
Absolutely.
You know, trying to keep away from the virus. But like he said, they were ignoring maybe the elevated PSA. In my case, they weren't taking care of their blood pressure. They were having symptoms. They were scared to scared to go to the doctor. Or like he said, we had limited hours. And with telemedicine, it's just totally different.
Sure. And most practices, but not all, have taken the necessary precautions to keep patients safe, and not only just keep patients safe, but also to keep the employees and the staff safe.
Yeah.
So, and we still abide by those same precautions, just to make sure that the chance of them becoming infected by coming to the doctor's office is minimal, if at all.
Wow. So Dr. Aguilar, when we did not go to our primary care or our specialists in certain cases, we ended up in the hospital. Tell us about that. How did it impact patients? How did it impact the whole hospital scene at that point?
Well, it was actually a big impact for the hospital, not just economically, because the hospital was not able to afford the amount of patients that were coming, and actually, as Dr. Rayford, Dr. Gubin says, a lot of patients were not able to get appropriate tests done or something that was already planned for other things. Because the amount of beds available for the pandemic was minimal at some point. And of course, we as hospitalists, we carry the patients for a short period of time, but during that short period of time, especially during this pandemic, we learned a lot from them. We learned a lot from families, because we were actually involved so much on the care of the patients that we were part of their family when they were not able to see any family members in the hospital. Which was one of the biggest impacts that we saw on these type of patients. Patients with COVID-19, not just physically impacted with the disease per se, having respiratory symptoms, having severe physical deconditioning, but also impacting psychologically with depression, anxiety, and those that will definitely affect the quality of life of patients.
Wow. And we'll talk about that a little bit more specifically in a moment, because we realize that mental health, as you said earlier, has been impacted in a devastating way. Let's talk a little bit about gender, though. Let's get into this men's health part. Did we see more or less, or more men or fewer men, or has it been a negative impact on men greater than women? What have you seen? I'll start with you.
Okay. I'm seeing more men now who are beginning to come back in, and who were stating that they were afraid to come out. But, so I think there has been a disparity with respect to women being more likely to come in to continue their urologic care than men. But men now are beginning to come back in. So there has been a disparity.
Okay. Dr. Aguilar?
It's been actually very interesting topic that you're bringing up. I was reading an article through the CDC, and we're basically, even though we are seeing almost the same number of cases, among males and females, there's definitely more men dying from this disease than women, and they are trying to identify the reasons for that, and they kind of look at based on sex component and also based on gender component, why we are seeing more cases in men than women. And very interesting, physiologically, the way these virus reach our organism is through a specific receptor. And we notice that this receptor, when you check it on the blood, has more presence on men than women. And also, just by genetics, women's, because they have two, X chromosomes instead of XY that we are, they have a better way to fight against viruses than men's. So that's another, reason why we are seeing more severe cases on men, but also in the gender part. We've seen a lot of times that unfortunately men are involved or engaged on high-risk behaviors and not necessarily taking the appropriate precautions as females. Also, during the pandemic, when we shut down everything, but we were still seeing people who work in places with priority, right, like healthcare systems. We were seeing a lot of males working in these type of environments more than females. That's another reason probably why they got affected more. But those are the things that this article pointed very well.
Yeah. So prior to the start of this panel, we were having some off-camera conversation, and you brought out an interesting point. You said men were doing bad before because we weren't paying attention and doing what we were supposed to do.
Yeah, I think men are, probably a little bit less compliant than women. But
That's not the word you used. You said hard-headed.
Hard-headed, exactly.
Okay.
Exactly, hard-headed. But like he said, it's been interesting because the prevalence has been pretty much the same, but more men have died than women. I mean, all over the world, they've seen that, just like what he said. And they also said that men were less likely to wash their hands. Men were more likely to take risky chances, maybe go places when women would stay home. And I think a lot of times men would also present later. They may have symptoms, but be a little macho and not go to the emergency room until maybe they're 3 or 4 days into it, and they're already sicker when they got there, and it hasn't done as well. But this is all theory. We don't really know, but we know exactly what Dr. Aguilar said, that more men seem to die than women.
Can we reverse these trends? Are these things that we can take control over, or are they so baked into our society, into our DNA and our behavior, that we're just doomed forever?
Well, I think having programs like this and more men came, and we educate a lot of men about it's very important to take care of your health and you don't need to be macho. And I think during this pandemic, a lot of men have thought, I'm the provider of the family. I can't be sick,
Right.
And they kind of ignore symptoms.
To be able to reverse this trend, we have to start at a very young age. Because at the youngest of age, we teach our young boys to not cry, be a big boy, you're a little man. From an early age, we put that pressure on our young boys. So they grow up with this macho attitude. In addition to that, even the healthcare system, I think we have almost failed our young boys, because other than a testicular exam, there's really not much preventive measures recommended for young men. And it's not until men start having symptoms of cardiac disease or diabetes or something, or with respect to prostate cancer, you don't come in until you're 40. So you go from, wellness checks when you're a child, and there's this huge gap in healthcare. And it's that gap is when I think when we lose them. So as Dr. Gubin was saying, having events like what we're having tonight, and making sure that we educate these men about chronic health conditions, that's what it will take to reverse the trend. But we have to start off at a very, very early age, I think.
You bring about a very interesting point that I had never thought of until you said it, but young girls are constantly getting checkups
Absolutely.
Throughout their lifetime.
Absolutely.
And then young boys kind of go from, if you're not playing sports, don't come back until you break something.
Exactly.
Yeah, that
Right.
kind of idea. I never put it in that perspective.
Right.
Thank you for that insight. Dr. Aguilar?
Well said by Dr. Gubin and Dr. Rayford. Just add something. Having a separate data by sex will help too, because, and of course, this is a new problem. This is a new disease. This is a pandemic that we are learning, still learning every day. But having a data just for males and females will help us to understand what's going on with this particular group. And also, as I said, engage on high-risk behaviors like tobacco abuse, alcohol abuse, will also, put us at risk to be in, more risk to get this disease. So it's important, to discuss about those particular things with patients too, and families.
So all of those were excellent responses and just really not the traditional cookie cutter responses that we would have thought about. So I want to dig a little deeper when it comes to male health, and I'm going to deal with it in groups of men that we find in the Mid-South. We find a large population of African American men. We have a growing Latinx community among us. Are we doing enough to educate those groups who are traditionally found in the disparities category? Anybody, just jump right in and go.
Absolutely not.
Absolutely not.
No question about it.
All right, tell us more. What can we do? What should we be doing? What do you think?
As Dr. Gubin mentioned, the key thing is education. Key. And one of the things that I learned when I was in New Orleans prior to coming here is that you can't have these one and only event. What I mean by that, you just can't educate men on Men's Health Week and then come back the next year. It has to be an ongoing educational process. And this week we're going to talk about prostate cancer. Next week we're going to talk about heart disease. Next week we're going to talk about diabetes. Next week we're going to talk about chronic back pain. Next week we're going to talk about something else. But it has to be a continuous educational process. And supplemented with the educational process, you have to encourage men to see their physicians. You have to encourage men to talk about health issues among themselves and among or within the families. So there are a number of things that we can do that we're not doing.
Wow, good. Did you say chronic back pain? We need to have something?
That's one of the top 10
One of-
reasons why men go to see their physicians, chronic back pain.
Yeah, that's a good one.
I think also, like you said, the education has to start at an early age.
Absolutely.
Because in cardiology, heart disease starts at in your early 20s. You have risk factors. You can start having, like the Vietnam War, when they did autopsies, they saw these people had early atherosclerosis at a young age. So we need to educate them earlier. A lot of times we don't do our education until they're, older and already having issues. And I think, especially in the minority groups, we could do a much better job with education. We got to teach people that it's real important not to smoke, to exercise, to keep your weight under control, help with stress. We got to tell, like you said, men a lot of times are embarrassed to go to the doctor. They're embarrassed to say they're having an issue, and they need to be able to speak up.
Great insight.
I think compliance is also a key factor. And also, be responsible of your health. I cannot tell you how many times, I see patients at the hospital and I ask, but why you're taking this medicine? How many times? And basically the answer is, well, I don't know. Someone else give me the medicine, or my wife prepares the medicine for me. And that's really shocking, because you have to this is your health. You have to be responsible for it. Because as we said, we tend to have this macho behavior, but if we think about it, and we are the providers of our family, we need to be responsible with that, And
Wow.
that's a way to be responsible with our wife, our kids, our community.
Wow, that's great insight, great wisdom. So you brought up something a moment ago that I said we needed to come back to, and I know that we are all professionals in different disciplines, but mental health and the whole idea of depression. The scenario that you described was how the practitioners became family members because at one point people couldn't get in and out to see their loved ones. And there was a lot of weight or a lot of burden, first on practitioners as well as patients. Describe that relationship and then What can we do to improve and encourage men to seek counsel in that area as well? I know it's a mental health question, but I want the docs to weigh in on it too.
When this problem started, and you can see it was very shocking. See people crying in front of you and saying, "I haven't seen my family for months." Patients on nursing homes not able to see family members for almost a year. That was very, very shocking. I think we as a healthcare system have to keep this in mind. And actually, telehealth was one of the things that came with this problem. And it was a good opportunity. From all this bad, I think we learned certain things, and telehealth was one of those things that help us as a healthcare system to improve patient care. So at the hospital, we developed certain strategies to do some FaceTime. Patients in intensive care unit, we try to bring the patients to not necessarily bedside, but looking the patients from outside through the windows, things like that. I had multiple times in which I used my own phone to do FaceTime with family members, and I didn't mind at all, because we always have to think that we can be in that position one day, right? So I think we have to be as compassionate as we need to be with this type of diseases, and we learn a lot. I think we learn tremendously, from this. Now, in regards of what we are seeing, not necessarily just at the acute disease process, now there's new terminology coming. There's this long COVID syndrome now, long COVID disease, that we are seeing now on these patients having depression, anxiety, post-traumatic stress disorder, weeks after the acute presentation. Therefore, I think as a primary care provider, we are primary care providers at the hospital, but when the patient leaves the hospital, it's very important to involve social workers, case managers, to get these patients to be seen by the primary care physicians as soon as possible, so they can identify these problems as early as they can, so you can act on it and prevent, deterioration of those mental health issues.
Wow. Anything to add?
Yeah, to say, stress is one of the greatest risk factors for cardiovascular disease. And I think everybody before the pandemic was under a lot of stress. And with the pandemic, stress and anxiety is just, off the charts. And I think we need to educate men that it's okay if you're depressed or you're having anxiety, you can't sleep at night. This is normal during this pandemic. And you shouldn't be embarrassed to tell someone and seek help. I think a lot of men have these symptoms and they're scared to seek help. And I think as a physician, I've learned, we always talk about, are you short of breath? Are you having chest pain? Are you having palpitations? But now I'm asking my patients, how are you sleeping? Or are you depressed? Or, asking questions about mental health. Because I think, we miss that a lot.
Okay.
I think one of the key things that men must do is to find someone whom they trust and to be able to talk and share about very private issues that may be going in their lives. And oftentimes it's a friend, so a childhood friend. It could be a family member. But I think talking about these issues to a trusted individual can be very helpful. And then to use as an example, dropping a pebble into a large body of water, then allowing the waves to expand. Hopefully, just by talking to that trusted individual, then that will allow that person to begin to share his concerns in a more broader audience.
So I'm going to give you a 30-second beat me up moment. All of you get to take punches. You've already taken some, Walter, because here's what you said. You said we can't have these events just one time only. And so what you're saying to a hospital administration or a person who's in administration, that we have to do this on a repetitive basis. We have to do it more regularly. And for a person in community health like me and our team is, we have to bring it to the people who need it. But I'm also a pastor. What can churches do? What can places of worship do? And what can our administration do? We're a faith-based system. How can we help in this area?
Well, I think
You
already
get to
did.
beat me up for 30 seconds. Go.
Well, you already did because you had this program tonight. You know? So, I mean, I think that's a good start. But I just think that y'all are, as a pastor, you're aware that a lot of patients who have COVID have some mental issues. And like he said, you have to have someone confident that you're confident in that you can talk to. And I would think that a lot of the, people that have had these symptoms would feel very comfortable talking to someone like you, and just to be available and to educate your congregation that this can happen. And if you have an issue, please talk to me.
Great.
I think it's important, in addition to what Dr. Gubin said, is, and I'm sure you have it here at Broad, and that is you have to have a health ministry. You have a very active health ministry. And the health ministry has to realize that oftentimes we don't have all the resources that we need within our congregation. Therefore, we have to form partnerships with other entities. For instance, you're forming partnerships with Baptists. You're right next door to Christ Community. There are other partnerships within the community that you have to bring the expertise in to talk with, with your congregation. I think, and this is not to beat you up, but I think oftentimes we place too much stress on the pastor, because the pastor can't do it all.
Hallelujah.
Right. So therefore, pastor has to have another committed body who can do all of those things and address all those needs that the congregation needs.
Yeah. We'll give you some membership paperwork right after
Great.
this session is over, so you can become our resident health expert. All right. Come on, Dr. Aguilar.
I think church plays a key role on mental health, actually. It is, it is tremendous what you can do having people congregated here, people who can learn from experience from, another one. So, education-wise, I've been involved in some Spanish communities, with some Christian churches, and we've been able to do some education about vaccines. It's incredible the amount of things that you can, that one person said to the other, and these just transmit to others and others and others, and the communication gets completely broken in between, and that will affect the community. It's very important what you can do here at the church, communicating, educating, because, at the end of the day, we have to understand that God put us, these challenges in life, but the church is a key part to help us moving along and, and knowing that we have Him next to us to keep going.
Great response. And so before we go to our audience participation and those who've gathered, I did want to say that we offer a component of our Baptist Healthy Communities outreach to churches. We partnered with churches and synagogues and mosques all over the region, and we try to make sure that we get this information into the communities. We've even done, the outreach team has done a great job in breaking down language barriers, making sure that we have translation materials available so that if people come from different walks of life, or if they are non-English speaking people, there's a line that they can have their voices translated and get the right response back to get the best information. That was a barrier with vaccines early on, not post-COVID, but right in the era where we were trying to move to get anyone vaccinated. Everybody was running into language barriers, and so there was some difficulty there. But the outreach effort also partners with churches, and so as people are watching this, I want them to know how to reach out to us, know how to call us for their needs, so we can come into their communities, into their places of worship, and into those groups where men will gather and glean information. So listen, I want to go to some of our audience questions right now. And since we were talking about it, I think we are privileged to have Rabbi Jeff Dreyfus with us on tonight. I'm going to ask Rabbi Dreyfus come up to the microphone. He has a question for us. And go right away.
Hi, thank you so much for having me, Rabbi Jeff Dreyfus from Temple Israel here tonight. My question is not just for clergy, but as members of religious communities and spiritual communities, what are things that we can do to uplift other people in our communities, to encourage health and going to the doctor? What are things that we as religious communities, not just top down from clergy, but actually members of communities can do for one another to encourage good health?
I think if we get, together, as you said, we have different, religious beliefs, but I think, during these difficult times where the whole humanity has been suffering from this, we have to understand that we are not a separate entity. We have to work together, and it's only one God, no matter what, and we need to get together, participate between churches, and get more people together to educate and involve on early behaviors to prevent more catastrophic events at the end.
I would answer it also as a pastor, but as a friend. I plan on being a friend to my friends far longer than I'm going to be a pastor. One of the things that I often share with them is, as I grow older, I'm not making a lot of new friends, so I need them to be around for 50 more years so I'll have someone to talk to. And so we bring up conversations of health accountability, and we talk to each other. We'll start off kind of teasing each other, but then it turns into something a little more serious because it's something we have to own. I don't want to be the only guy sitting around talking about where all of my friends have gone. I want to have my friends here so we can talk to each other.
That's a great answer. I was going to say also here, I talked about heart disease being the #1 cause of death of both men and women. It's most prevalent here in the Mid-South. So if any place in the country needs help, it's here. And if all the churches and synagogues and mosques and everybody got together and educated people, it would make a world of difference. And Keith and I both work for the Heart Association,
Right.
and that's why I like it so much, because we're trying to educate people about risk factors.
So my response is, for things that impact population health, what I would like to see is for ministers, faith leaders, to get out of the siloed approach. In other words, I'd like to see some interdisciplinary and ministerial alliances created, focus on a single issue that everybody is concerned about. So in other words, I don't want just the Baptists to be talking among the Baptist ministers, or the Methodists just talking among the Methodist ministers. I want everybody coming in the room together and finding out how we can work together as a team as opposed to within our silos.
Excellent response.
Yeah, I like it.
I've studied world religions, Rabbi Dreyfus, as I'm sure you have, not in Juneau, Alaska like you did, but we know that two of the common tenets of all faiths are love and health. Love and health.
Absolutely.
They run consistently through every faith practice on earth. Thank you for your question.
Thank you. Amen to that, and thank you for convening us tonight for this discussion.
Thank you.
Great. I have another question from Kendall White, who is a gifted and talented teacher with Shelby County Schools. Step up to the mic and give us your question.
All right. Good afternoon. I just have one quick question, and it's really dealing with men's health and losing weight. So I was wondering, what can men do to lose weight? I'm saying post-COVID, even though I know there's a new strain that just came out, but post-COVID, and then live a healthier lifestyle.
Well, I think, I think being overweight is a big issue, especially here in the Mid-South. And during the pandemic, it was even a greater thing because people, they weren't going to, exercise clubs, they weren't exercising, they were staying in the house, they were eating more. So now that we're starting to get out, people are getting vaccinated, I think it's important to stay active, to have a good diet. And if you need a boost, there's some good health and good weight loss programs out there. And even at Stern, we do have a weight loss program. I don't think it's something you'd want to stay on long term, but it gives you a boost. And I think once you see yourself losing weight, it gets you more confident, more motivated. So I think the key is exercise, watch what you eat, and stay active.
Overweight linked, obesity linked with elevated blood pressure, diabetes, elevated cholesterol. We just know now that it is one of the biggest risk factors to die from COVID-19 too. So I think that's a very crucial point to emphasize, to be a motor to let people know, you have to change your behavior, you have to change your lifestyle. There are studies showing that people who was engaged on exercise and got COVID, they got a better outcome than people who was not engaged on, on exercise and they got COVID. So I think that's a key point to say.
I think one of the basic tenets that what they mention is the fact that you have to be consistent. And you can't do it for 1 week and come back again and do it in 6 months later. You have to develop a consistent plan of diet, exercise, sleeping well, monitoring very closely what you put into your body, etc. But it has to be consistent. You can't be one on, one off.
All right. Thank you, gentlemen.
So I'm going to have a little fun with that question, all right now. I'm going to ask all of us to step down on the floor and get a wide camera shot, right? So there's this thing called body mass index and weight, right? Now look at all of us. I'll never be his size. Nope. I don't ever want to be your size. I can't be Walter's size. Let's talk just for a moment about what happens with men when you start talking about body mass index and weight loss. Because men will say, I don't really think I'll ever be what they recommend on those charts.
I can address that. I mean, theoretically, a normal body index is less than 25. But if you're stocky and muscular, like you said, your body mass index may be a little bit elevated, and you can still be normal weight. I mean, the body mass index is a category, but it's not perfect for everybody. So everybody's a little different.
So I've been told a couple of times I should be around 190, and I feel like 190 for me is way underweight. But I do want to make sure I do all of the other things, cardio, make sure I eat right, make sure I'm managing my blood pressure, make sure I'm seeing my urologist on a regular basis to avoid prostate cancer. Can I find balance in there? If I were just talking to the guy who's this guy's gone 25 years post-football now. He's not going to drop all that weight. You got to give him something.
I mean, if your body mass index is a little elevated, but your blood pressure, your blood sugar, cholesterol, stress level, you're getting plenty of sleep, PSA is normal, I think you're going to do well.
So managing those things are extremely important.
Extremely important.
Okay, all right. Brothers, I'm trying to find us a little help in here, okay? Y'all need to know when to say amen in the church audience, all right? I'm just trying to help out a little bit. We have another question. I think it's a very important question. Walter Banks is here. Walter is Human Resources Vice President at Baptist Memorial Healthcare. Step up, Walter, and you have a couple of questions, really, that you want to let us have today.
Thank you. Thank you very much.
Walter,
Pastor
first of
Norman.
all, you are a survivor, and you look great.
Well, thank you very much.
Yeah, you are.
Thank you. Hospital took very good care of me, when I was sick with COVID. I want to start off by saying this panel discussion here is very much appreciated. This is what I refer to as real talk regarding men's health, and I thank you all for being here.
Sure.
My question really is based on prostate health and the course of action to be taken to create early detection around that. So my question is, should men get regular screenings? And if so, at what age should that occur? Because I've gotten conflicting information regarding that. So what are your responses to that question?
Several years ago, Walter, I had a radio show where I would just talk about chronic health diseases. And one of the things that struck me was that at the end, I would talk about what type of preventative measures we could take to mitigate the risk of that particular disease. And everything turned, ended up at a very, very similar place. You have to eat well, eat a healthy diet, get plenty of rest, exercise, minimize the amount of alcohol you intake, don't smoke, etc. Manage your, good healthy living. So a good healthy living can lead to a good healthy prostate. Having said that, there are a number of screening guidelines. There's the American Urological Association, there's American Cancer Society, there's the R. Frank Jones Urological Society, which is the African American urologist. There's a National Comprehensive Cancer Network guidelines, but I'm just going to focus on probably the guidelines that most people are familiar with, and that is the American Cancer Society guidelines. Well, the American Cancer Society guidelines say that if you're at average risk meaning if you're Caucasian without a family history of prostate cancer, then you should start getting screened at the age of 50. If you have moderate risk, which means if you're an African American person with a single family history of prostate cancer, you should start getting screened for prostate cancer at the age of 45. Okay. But if you have an increased risk of prostate cancer, African American or men who have more than one first degree family relative with prostate cancer, you should start getting screened at 40. Screening means two basic things. One, a blood test, and secondly, a digital rectal examination. Now, the blood test should be at a minimum a PSA. PSA is is an acronym that means prostate-specific antigen. It's a protein that's produced predominantly by the prostate gland that's secreted within the bloodstream. So, with all of those age guidelines, you should get at least a PSA and a rectal examination.
Okay, thank you.
Did I answer?
Oh, yes,
all
you
the
did.
questions?
Yes, you did. Thanks.
Okay.
Well, my next question really was going to be around what kind of things, if you've gone beyond those ages that you just mentioned, what kind of things can we do now as men to improve our prostate health? And I think you covered some of them with regard to eating right and exercising and so forth.
Right. Nothing more to add than that, just healthy lifestyle.
Okay. Well, thank you all very much.
Thank you, Walter. So, Dr. Rayford, I have to ask one question. Help me with this one now. Say it ain't so, but if it is, just let me down easy. Charred food. It is said that char-grilled or grilled food, like on those marks on the chicken and the ribs and stuff. We eat our barbecue in Memphis, right?
We do.
And it is said that we should not eat as much. Is that true?
That question probably is better answered by Dr.
Well, the
Gubin.
meat part, but in the char, but is it the char?
I mean, I've just always heard that the chard sometimes can increase your risk of cancer. I mean, I've heard that.
Get
Right.
out of here.
I mean, I've heard that. I don't know if it's true or not.
I'm not quite sure if there are any scientific studies that can validate that. I'm not aware of any.
Okay. So if I go to Barbecue Fest, you're just saying I can't eat all the stuff I want to eat.
In moderation. In moderation.
In moderation.
In moderation.
All right. Well, thank you. I'm feeling a little bit better now of that because, one weekend I was down there, I could have got everything all at once. So we have one question that was texted in to us. It came in through a feed here. Given the adverse impacts of COVID-19 on the African American community, are we seeing higher health disparities regarding heart disease, high blood pressure, cancer, diabetes, and stroke? Are we seeing an increase given the adverse impact on the African American community? Are we seeing more of it now, or
From the
you think
pandemic?
from the pandemic? You think we'll see more of it?
Well, I would say that hypertension, diabetes is probably a little more prevalent in the African American community. And I think not only in African Americans but Caucasians during this pandemic, we've seen an increased risk because people haven't been as compliant, they haven't been exercising, they gained weight, they haven't been going to their doctor. So I think the risk is going up, not only in African Americans but also in Caucasians, but it was probably already a little bit higher in the African American population.
Okay.
And Dr. Gubin can definitely say this better than me, but on patients with comorbidities already, like congestive heart failure. We've seen a significant amount of increase on exacerbations just because of COVID-19 too. Arrhythmias is another factor. We've seen an increase. I've seen a significant increase on patients with COVID-19. They said 5 to 20% of the patients are going to develop any type of arrhythmia with this disease. And of course, difficult managing blood pressure, difficulty managing blood sugar just because of the inflammation process from this disease.
Okay.
So I think with respect to prostate cancer, that we are seeing an increased prevalence of prostate cancer. But I don't think the causative reason for that is COVID-19. But we really won't know with respect to cancer for another 2 to 3 years down the road when we can really see actual data on the prevalence of not just prostate cancer, but the prevalence of cancer and in the prevalence of or in the risk of death. So there's an increased number of prostate cancer, but I don't think COVID-19 is the cause of that.
Okay.
I also like to say that, like he mentioned long COVID, like symptoms can occur like 4 to 6 weeks afterwards. There's a lot that we don't know about this pandemic, and we don't, we think that, it does cause a lot of inflammation, and we worry about inflammation in the heart. It can cause myocarditis, which is inflammation in the heart, and we just don't know, but they've done some MRI studies, and they've seen some evidence that there is some cardiac involvement, but, patients are asymptomatic. So over the next couple of years, we'll have to see what happens. We don't know yet. It's just too early to tell.
Thank you. We have another community leader who's with us. Mauricio Calvo is the executive director of Latino Memphis. He has a couple of questions he wants to share. And that previous question, by the way, was sent in by Reggie Crenshaw, who is the new president and CEO of Leadership Memphis.
Oh,
and
wow.
so I'm glad he was able to participate.
Well, hello, hola. I'm proudly wearing my Latino Memphis Baptist mask,
Okay.
so I wanted to show you that. Thank you.
Another outreach effort from Baptist making Baptist
Yes.
healthy communities.
We're
Right.
very thankful for that. So my question is about the holistic approach to medicine. If we believe that the doctor-patient relationship is a two-way street, and I think it should, what are doctors and other healthcare professionals doing to not only become experts in your specialty, but to better understand the social and cultural determinants of health? So, are doctors up to speed on people's sexual orientation or the impact of your immigration status on your health? And it might be that there is no direct correlation, but I do believe that when you go to the doctor, you're more than just the issue that you have in front of you. I heard Dr. Scott Morris one time say, I do believe that, he said, I want to cut an ankle monitor from most of my patients because I truly believe that it causes stress and it causes high blood pressure. I'm like, doctor, I don't know if you want to do that, but but that's, of course that's Scott, right? But it's interesting, right? I mean, we are more than just high blood pressure or this or that, and are you guys getting up to speed on these things? Because I believe sometimes patients feel that he's not going to understand where I'm coming from. He doesn't understand all of these other things that I carry that probably cause part of my disease.
So I'm going to start by helping this team. I know they do an excellent job, but it'll start with our community health needs assessment. This team that's put this wonderful forum on tonight is responsible every 2 years for completing an assessment across all of this region, every 3 years actually, across the entire region to make sure that we know what the issues are. What may be an issue in the northeastern part of the United States or the northwestern part may not be the same as the southeastern United States, and specifically in the communities in which we live. And so we go out and we gather this information, and it is to plan and chart a course of action so that we set up the necessary responses for meeting the needs of people in our community. When we see high evidence of diabetes, we put those programs together. When we see high evidence of stroke or heart or prostate, whatever it may be, We respond to it through those community health needs assessments, and those are done and updated regularly. Because they change, they should change, hopefully, if we're solving some of the problems, but there are always new problems that are being created. And so that would be one way from an administrative and systemic or hospital system way of fighting that. I'll let the practitioners jump into it in their areas as well.
I mean, I think what you said is very important, that we have to be more of a holistic approach. And I can tell you from my own personal experience that, you know, I've always kind of focused on cardiac symptoms. And during this COVID, it's made me think more about the mental aspect. You know, I wasn't as good before this pandemic, but that's made me much more aware of that. And I think we're all trying to do a better job up here on this podium. We're all different. I have a hospitalist and a urologist, and we see a lot of the same patients. And I think we're trying to do a better job in communicating so we know exactly what's going on.
I do think that we as physicians need to be as open as we can be, understanding different cultures. I mean, as Pastor said, hopefully these, you know, studies population change with time, because I've seen a significant increase in the Spanish speaker population in this area. When I came here in 2011, I probably see maybe once a month a Spanish speaker patient. Now, I always carry, you know, some patients on my list. And I know they actually get more attached with me because we speak the same language. I completely understand that. When I go to my own primary care doctor here, it's very difficult sometimes to explain culture, you know, food that I eat that is completely different than what we do here. So we have to be more open to listen, to interact with family members. And, you know, right now there are different tools that we can use, so the language barrier is not going to be there anymore. And, you know, I think that link between the patient and the doctor and the relationship will just flourish and get better if we do that.
So that's a very interesting question. I think it's a very, very important question, and that is trying to ensure that the physician at least understands the many social determinants of health that may be involved in a person's health presentation. Many times as physicians, we're so regimented in what we do. We go from, you know, the chief complaint to the history of present illness to past medical history, past surgical history, and oftentimes we don't ask some of those SDOH type questions, social determinants of health type questions. And I think it's very important to be able to communicate very openly and freely with your physicians to make sure that he understands some of those things that may be impacting your present health conditions. So I think you know it's a responsibility of the patient to make sure that they communicate that, but it's also the responsibility of the physician to make sure that they ask those questions and understand those things that may be contributing to their current health condition.
So, Mauricio, you saw something and you participate in something periodically around our city and different things on the task force for COVID. One of the things that we saw was that these issues are not the medical community only. We realize that it is necessary for communities to come together to fight any health crisis. Like Dr. Rayford said a moment ago, it behooves the faith community to come together across what are typically denominational lines that separate us. It also behooves the community to come together to say, you know, I'm not in healthcare, but I really am, because if there's not a grocery store in a community where people can get good vegetables and get good food, that's contributing to the health disparity. Well, I'm in law enforcement, but if there are a lot of guns in the community, it's impacting the health of that community. And so we see that it's really not just the doctor or the hospital that's going to improve the overall community health of any particular organization. And when we come together, look at what we did with COVID. Look at how this community rallied together and said, we can beat this. and put our collective strengths and efforts together, hospital systems working with each other, government, business, and everyone, and we rallied, and we're winning right now.
Right. Very good. Thank you.
Thank you.
These have been some excellent questions, and I thank you for your participation. I want to give you just a moment or two to kind of give what we think would be a wrap-up piece, or maybe something you'd like to share, that burning passion, that recommendation. It's men's health, but you know, you can even throw in something for the women. You can tell the women how to make the men do better if you want to. That was one of the questions that we considered. How you know, because let's face it, women run the house, right? They, you know, if the woman says get up, go to the doctor, you get up and go, or that happens. But what would you encourage us to know right now?
I mean, the health's important. I think it's very important that you're very proactive in taking care of your health. And if something's bothering you, try to feel comfortable talking to someone. You know, it could be clergy or whatever, but make sure that you try to tell someone about it, a good friend or whatever. Don't just ignore it. Be proactive.
Thank you.
I agree with what Dr. Gubin said. Be proactive with your health. Learn as much as you can. Live a healthy lifestyle. That's for the men and for the Baptists, for the community health organizations. Don't be a one in, one out. You know, establish a ongoing relationship with the community and build partnerships that extend beyond Baptists. And one of the things that I'd love to see in Memphis is to break down these walls of Baptist, Methodist, St. Francis, and realize that we are one community. And until we adopt that one community approach, we're still going to be fighting some of the same battles 50 years from now that we're fighting now.
So, you know, doctors are terrible at this. I have to kind of coach them a little bit. When you get a parting shot, you're supposed to include stuff like the name of your practice and the fact that you're still seeing new patients and that kind of stuff. I mean, I don't know. Are you?
Absolutely.
Yes. What's the name of your practice again?
The urology group.
The urology group. Okay.
Yes.
And you are still seeing new patients?
I'm still seeing new patients.
All right, great.
Yes.
And you are
With the
with?
Stern Cardiovascular Foundation, part of Baptist, and still seeing patients for
All
sure.
right. And Dr. Aguilar?
Well, I'm the part of the hospital is BM Baptist Medical Group in Memphis. So of course we're seeing new patients every day.
Every day.
Yeah.
Right. Right. Any parting words for people in our community that you would encourage us to think about and to do?
I think we as humanity have one of our greatest opportunities to be prepared for the uncertain and also take care of each other. I think one of the key things that we should learn from this virus is if we act together, if we get together, if we fight together, we'll be able to beat any challenge that life will put in front of us.
Well, thank you very much. Dr. Aguilar, Dr. Rayford, Dr. Gubin, thank you so much for your time. We could not have made this happen without you and without the people at Baptist and the Community Outreach Department, Anne-Marie, Cynthia and her team, and Nick and Kimberly and all of that group. The people at First Baptist Church, the staff here, they do a great job in creating space for forums like this. The administration of Baptist Hospital, who makes it possible and wants this kind of information to get out there. So thank you for just giving your time, your expertise, your thoughts, and your guidance, just showing us what to do and how to do it. I want to thank our community leaders who stopped by to represent voices in our community from different aspects, from the faith community, from the Latino Memphis Latinx community, just from people abroad. Thank you so much for sharing with us on tonight. There was something for every age group, every segment of our population. Even though we talked about men's health, this applies to everyone. Be proactive. Take control of your health. It is the most precious gift you get in this lifetime, and you don't get any do-overs. So again, this has been recorded. It will be released on our webpage, on our Facebook page. It will be there for the viewing. Please encourage people to go out and watch it and get this information to as many people as possible. Thank you for sharing with us.
Thank you.
Thanks for having us. Keith, thank you